Patricia here with Rapid NCLEX. At Rapid NCLEX, we are dedicated to making your NCLEX journey a success. Did you know that as of April 1st, 2020, the NCLEX exam trend is going to change? How are you prepared for this? Today, I'm going to take you through some of the changes that you are to expect in the NCLEX exam from April 2026. You walk into your shift, your patient suddenly passes the call bell. He says, "Nurse, I feel this tightness in my chest." His vital signs were BP 88, 60 millimeter mercury, heart rate 120 beats per minute, oxygen saturation 90. You have 30 seconds to decide. What are you going to do? Do you give oxygen? Do you call the doctor? Do you administer nitroglycerin, or do you sit and reassess? Because here is the truth. On the NCLEX exam and in real life, it's not about what you know. It's about how you think. It's about how you prioritize and manage your patient. The NCLEX is no longer asking what is the disease. It is asking what will you do when the patient is crashing in front of you. And if you choose wrong, that patient doesn't get a second chance. Things are changing and you should know how to say this matter. You will have a total of 5 hours and you are going to get 85 questions a minimum or 150 questions maximum. Once you get to 85, the computer is going to decide a passing or a failing. And take note, the next generation NCLEX, which is the NGN, isn't going away. Clinical judgment question is still going to stay. And take note, the NCLEX exam is changing, but it's not getting harder. You should learn to practice case-based questions daily. Train your brain to ask, what is the priority? What will kill the patient first? And then focus on ABC, which is the airway, breathing, and circulation. You also focus more on safety and focus on the Maslow's hierarchy in case you have a question, and this will help you arrive at your answer. So the key core areas you can focus on: pharmacology of all types, medical, surgical, pediatrics, maternity, and mental health. Focus on more on these topics. You can also get a partial scoring for questions not fully answered. So meaning if you are able to get a rationale, using a good critical thinking, you can arrive at an answer. So a rationale, if you give, you are going to get a partial scoring. You are also going to get multiple case studies. So case studies are not going away. You can get a question with 4 clients with prioritization. The best approach in answering prioritization question is when all the patient seems right. Think, what can harm them best? NCLEX is a safety exam. You are also going to get questions on confidentiality. So when it comes to social media, what are some of the things you should not post about patients on social media? Keep practicing more questions, especially the case studies. Learn to prioritize more. And don't forget, without content, you can never pass the NCLEX exam. Learn more content, know your content. And I think the NCLEX exam is going to be easier for you. Alright, see you in our next video.